My name is Dr. Piyush Nashikkar. I am an orthopedic surgeon and I specialize in arthroscopy and joint replacement surgery. However, my core specialty is shoulder joint disorders and I have keen interest in osseointegration surgeries in amputees. I am working with Oyster Pearl since around 1 year. Usually the patients of shoulder joint arthritis are old age patients. This is because shoulder joint is not an weight bearing joint, so it does not affect the locomotion. So the usual presentation is late, around 6 or more. It is age related disorder. So what happens in joint arthritis is basically the bones in the joint are covered with the articular cartilage, and when these articular cartilage worn off, two bones rub on each other and that causes pain. So patients usually presents with shoulder joint pain and sometimes with restriction of their range of motion. A patient with shoulder disease presents to us with uh, complaints of shoulder pain or shoulder stiffness. Now there are two kinds of patients. One category is young patients who are usually very physically active, and other group of the patients are usually old patients who have worn off their shoulders. Now, most of the conditions of shoulder pathology can be managed very well with medical treatment or physiotherapy, but usually these patients presents to us very late or in advanced stages, so we need to investigate them properly so as to direct our treatment to the specific cause. I do remember a lady. She was a retired teacher and was living with uh, son and daughter-in-law. She was always an independent lady, but recently, since I think from last 2 years, she was having problem in her shoulder. She was not able to use her shoulder, and that was taking a toll on her confidence. She had lost her husband and was in bad shape regarding her means of uh, daily living activity. She had something called massive rotator cuff tear, and the only solution available was uh, a reverse total shoulder orthoplasty, which was costly, and she didn't want under such a massive surgery. So what I did was a surgery called superior capsular reconstruction, where we took some tissues from the thigh and put it in place of rotator cuff, which helped her to relieve the shoulder pain, and she was able to do her most of the activities like combing her hairs, clothing herself, or doing activities of daily living without help from her son or from her daughter-in-law. I did my post graduation from KEM Hospital, Mumbai, which is one of the pioneer hospitals, one of the best hospital in India for orthopedics. Then I went to South Korea and Australia to learn uh, recent uh, recent technologies and recent surgeries and got trained there. After that, I am attending national and international conferences to keep myself updated. Recently, I presented a paper on uh, shoulder navigation in Shoulder and Elbow Society that was held last year in Mumbai. As we do as we do knee replacements or total hip replacement, we can also do total shoulder replacement. Now that is the awareness about the shoulder joint replacement is far less in India, but it is coming up because many patients are coming with the shoulder joint arthritis, and the aging population in India is growing. What excites me is the advances in shoulder. I was in Australia. I learnt about the shoulder navigation. Now, what happens in shoulder joint replacement is when you do surgery, only a small part of bone is visible. That bone is called as a glenoid, and it is very difficult to guess the position of bone when surgery. Now, with navigation, you can see on computer complete bone so that you can place your implants that are required for shoulder joint replacement in proper position to get maximum outcome. We are trying to get that technology in India, uh, but we are not sure when we can be able to get it here. My keen interest besides the shoulder is in osseointegration surgeries for amputated patients. Now, in amputated patients who have lost their legs, the only solution is to use artificial leg. Now, that artificial leg is connected to the remainder of native leg by the use of socket. Now, that has many disadvantages like sweat and having something stuck to their residual limb, which is very uncomfortable, and patient is never satisfied with the feel. So what we do in osseointegration is artificial leg. We attach the whole artificial leg directly to the long bone of the body or the skeleton of the body. In a way, patient starts feeling as if it is his own leg. So when a patient walks, he can actually feel the ground with the help of osseointegration. Now, osseointegration is done in only uh, uh, few centers around the world, and very few, like around 1500 to 2000 have been done till now, but has tremendous and have transformed the life of amputees, and I'm really interested in doing those cases in India, and we are trying to do those India to change the lives of amputees at an affordable cost. What I feel is every doctor should explain the condition or the disease of a patient in detail, and they should give them all the options available as in basket approach, and let the patient decide their treatment on their own, because that will that will enable patients to assess their own financial condition to get treatment and to get maximum outcome. Being a doctor, I think I have a huge responsibility, and one of the important is to explain patient what is wrong with him in detail. It is my duty to tell him all the options available to the patient and let the patient decide their own treatment. Now, this is called as basket approach, which will help to maximize the outcome at an cost affordable to the patient. My message to the general population is to get involved in physical activity, and my advice to the parents is to encourage their children to get involved in at least one sport and pursue it as their hobby or as competitive sports, because I think physical activity helps in elevating morale